because GAGs deposition happens in almost every organ, complications can also arise. And so we need a multidisciplinary approach for these children. So it means they need to be seen by a lot of different specialists for an optimum amount of care. So the main problem here for these children would be in the bones. So they would definitely need to be seen by an orthopedician yearly or even more frequently. A neurologist and a neurosurgeon may be needed because these children can have fluid accumulation in the brain called hydrocephalus, for which shunting maybe would probably need to be done. And same way, a more important problem here that can happen is in the spinal cord. The spinal cord can get narrowed and compressed because of the accumulation of GAGs. So this needs to be looked at an emergency basis. And again, a neurosurgeon and an orthopedician can look into it. ENT physicians. So these children can have deposition of GAGs in their throat and especially the adenoids and tonsils. So they may need to be operated for that. They can, because of this blockages here, they can get fluid accumulation in the ear, which needs to be relieved frequently by a simple procedure called myringotomy. We need to take special care of the eyes. As I told you before, these children can have corneal opacity or clouding of the cornea. They can have increased pressure of the eyes. They need to be seen by an ophthalmologist because they can have corneal involvement where the cornea can be clouded. They can have increased pressure inside the eyes, which we call as glaucoma. And sometimes the retina can also undergo degenerative changes. So definitely an ophthalmologist surveillance is very important for these children. Similarly, a cardiologist, because they can have valve thickening and cardiomyopathies can be there. So cardiac involvement, cardiologist needs to oversee. A respiratory physician, especially to look for something called pulmonary function tests. So because these children can have chest deformities and spine deformities, their lungs can get severely restricted. The normal breathing in and out, the normal exchange of oxygen and carbon dioxide can be impaired. So that needs to be checked with the help of a pulmonary function test. They can have umbilical hernias, have inguinal hernias, which needs to be corrected with the help of a pediatric surgeon. Very important here is the role of an anesthetist. So these children will have short, thick necks and they can have spine abnormalities. So very careful intubation and anesthesia is necessary. So an experienced anesthetist is very, very important in this scenario. These children can have sleep apnea, where their respiration stops for some time during sleep. So that needs to be attended to at the earliest. And we will do a test called sleep study, which will pick up these episodes. And if need be, the children can be put on something called CPAP, which will help them with this particular issue. Definitely, a geneticist needs to be in the loop to explain to the family regarding the disease, the chance of recurrence, what needs to be done to prevent this disorder from recurring again in the family, and to organize all liaison with various other departments. A geneticist is necessary. A dietitian to look into the diet for these children, and a general physician to look into their vaccinations like their yearly flu vaccination, pneumococcal vaccine, so that they are protected from frequent respiratory infections. So it's definitely a multidisciplinary and a multimodal approach that is needed for these children.